breathlessness despite 100% SpO2, exploring the causes. Maria sat on her couch, taking deep, conscious breaths, yet the feeling of breathlessness persisted. Her oximeter displayed a consistent 100% SpO2, the highest possible reading, and a clear indication that her blood was fully saturated with oxygen. However, her discomfort suggested something more complex than numbers. Despite having sufficient oxygen levels, Maria's situation wasn't uncommon. Breathlessness can occur even when oxygen saturation is optimal, as SpO2 readings only reflect the oxygen levels in the blood, not how effectively the body is using that oxygen. One potential cause of her sensation could be anxiety or panic. These conditions can trigger a fight-or-flight response in the body, leading to hyper-awareness of breathing and a feeling of not getting enough air. Maria remembered reading about this possibility in a health magazine and considered whether her stress-filled job might be a contributing factor. Heart issues were another possibility. If the heart is not circulating blood effectively, organs may not receive the oxygen they need, leading to a feeling of breathlessness. A sense of unease washed over Maria as she remembered her family's history of heart conditions. Lung problems like asthma or an embolism could also restrict airflow. Maria examined her breathing patterns and noted that though her lungs technically received enough oxygen, something might be inhibiting airflow to the alveoli where gas exchange occurs. Then there were muscular or structural factors to consider. Weak muscles or chest problems can hinder the mechanical process of breathing. Maria recalled her cousin's struggle with myasthenia gravis, a disease leading to muscle weakness, which impacted his breathing mechanics. Metabolic issues like anemia or an infection could also be the shadow behind her symptoms. Anemia, in particular, reduces the blood's capacity to carry oxygen, affecting its utility despite saturation levels. On a different note, Maria considered if it might be a CO2 imbalance. Overbreathing or hyperventilation could lead to a lowered level of CO2 in the blood, resulting in an unpleasant sense of breathlessness, a scenario her doctor mentioned during her last checkup. Lastly, post-illness conditions such as long COVID were potential suspects. If Maria had COVID-19 recently, her respiratory system might not yet be operating at full efficiency, making her more sensitive to normal variations in breathing. Maria decided to visit her doctor to explore these possibilities further. Although the pulse oximeter assured her of perfect SpO2 levels, she knew that understanding the underlying cause of her breathlessness was key to finding relief. Thus, Maria's journey towards uncovering the true nature of her breathlessness began, one that delved beyond the digital readings. Her determination to uncover the reason for her symptoms highlighted the complexity and interconnection between mind, body, and technology, and the importance of a comprehensive approach to health.